I've been really trying.
Do you like morning sickness?
Are you ready for sleepless nights? Does Lokia sound like something you want to deal with for 6 weeks?
Do you like screaming babies? If you answered no to any of these questions, we have just the solution for you. It's called contraception. First up, let's talk about the NuvaRing. NuvaRing is a small, flexible vaginal ring that's about 2 inches around. It releases hormones to stop the ovaries from releasing eggs and also thickens cervical mucus, which serves as a barrier to sperm getting to the egg. The ring is kept in your vagina for 3 weeks and then it is taken out for 1 week. Your period should come during this week off time frame. Out of 100 NuvaRing users, 9 pregnancies occurred, so there is still a small chance you might get pregnant. If you choose to use this form of contraception, be aware of common side effects that may occur, such as discomfort in the vagina, vaginal discharge, nausea, headache, breast tenderness, and mild vaginal irritation. NuvaRing does not protect you from STIs. Superb! Now let's see what these teens have to say about contraception.
Hi, my name is Katrina George, and every day during lunch, my friends and I take the pill. It's great because it's easy to remember because we each hold each other all accountable. And you know what's awesome too? It helps my cramps and my acne also. Ready, girls? It's so easy. We're 16 and not pregnant.
Like Kajina said, it is important to take oral contraceptives at the same time every single day, regardless of whether you are sexually active. These pills require a prescription and contain the hormones estrogen and progestin, which prevent the ovaries from releasing eggs and thicken the cervical mucus to block sperm. If you miss a pill, you need to use an additional form of birth control, like a condom. Out of 100 women who utilize this method, about 9 will get pregnant. The pill does not protect you from STIs, and the following side effects may occur: nausea, breast tenderness, headache, dizziness, and irregular bleeding. In rare cases, blood clots, heart attack, stroke, and death may occur.
But wait, there's more. Let's hop on over to meet Denise, a mother of 8 kids, yet no longer counting. Ever since she chose the depot shot.
Hi, I'm Denise. I'm a 43-year-old mother of 8. Life sure is a roller coaster when you have 8 kids. Because our schedule is so chaotic, it's hard for me to remember to take the pill every day. So I chose the depot shot, which allows me to only have to go to the clinic once every 3 months. It works by releasing progestin, which stops my ovaries from releasing eggs, and thickens my cervical mucus to keep sperm away. Research has shown that it is 99% effective. Thank goodness. However, doctors warned me that I might lose bone density if I get the shot for more than 2 years in a row, bleed between periods, have headaches, weight gain, nervousness, and abdominal discomfort.
Thanks, Denise. Now let's talk about the use of the small, effective, and convenient hormone patch. It contains 2 hormones, nice hand hygiene, which are estrogen and progestin, which prevents the ovaries from releasing eggs. The patch can be worn on the back, upper arm, lower abdomen, and the buttocks. You will replace the patch once a week for 3 weeks. Be sure to remove the old patch before putting on the new one. Every 4th week, the patch should not be worn so that menstruation can occur. The patch is 92% effective at preventing pregnancy, but does not protect against STDs. Possible skin reactions and risk for blood clots can occur.
Thanks, Taylor. Let's hear from Sally about our next contraceptive method.
Year-round, I count down the days till my annual women's wellness exam.
Ma'am, don't forget to always use protection. Feel free to take as many of these complimentary condoms as you would like.
Okay.
Other than abstinence, male condoms are the best protection against HIV/AIDS and other STDs. You do not need a prescription. You can buy them over the counter at almost any gas station, pharmacy, or supermarket. A condom is a thin film sheet made of either latex or polyurethane, rolled onto an erect penis right before sex. When used correctly, the male condom is 98% effective in preventing pregnancy by blocking the sperm from reaching an egg.
Thanks, Heather. Let's join Jaylyn in her lecture about the last two contraceptive methods. Okay, class, that concludes our lecture for today over the implant and IUD. Let's review. Where is the device implanted?
Taylor. I took notes on this, and the implant is a matchstick-sized rod that is put under the skin on the upper part of the arm.
Great job, Taylor. Now, how does this method work?
Heather.
Well, okay. The implant contains the hormone progestin that stops the ovaries from releasing the egg and thickens the cervical mucus to block sperm.
Precisely. How long does this method last, and how effective is it?
Laurel.
It lasts up to 3 years, and out of 100 women who use this method, 1 may get pregnant. That's correct, Laurel. Now, what are the side effects?
Brittany.
Possible side effects include weight gain, breast tenderness, and abdominal pain.
That's correct. Now let's discuss the IUD. Who would like to describe the copper IUD?
Laurel.
Okay, I have some notes on this as well. The IUD is a small device shaped like a T that is inserted into the uterus. This can be a costly procedure as it must be inserted and removed by a physician. The copper form is called Paragard. It releases copper into the uterus, thus preventing sperm from reaching the egg. It can stay in the uterus for up to 10 years and is 99.2% effective. It can also be placed within 5 days after a woman has unprotected sex as a form of emergency contraception. The side effects of the copper form include heavier, longer periods and more cramps than before placement. Okay, how about the hormonal IUD?
Brittany.
The hormonal IUD is 99.9% effective. It releases progestin into the uterus, keeping the ovaries from releasing an egg and thickening the cervical mucus. There are 2 different hormonal IUDs called Mirena and Skyla. Mirena can stay in the uterus for up to 5 years, whereas Skyla can stay up to for 3 years. Possible side effects include breast tenderness, mood swings, weight gain, perforation of the uterus, breakthrough bleeding, and other menstrual problems. Many women using this form have lighter, less painful periods than before. Some may stop getting a period at all. But this is not harmful and does not need to be treated. It is perfectly normal. Regular periods will return when the device is taken out.
Great job, class! Let's face it, having a baby is not on everyone's to-do list. Ask your doctor which contraceptive method is right for you.
Effective. And
Guys! Dang it! I was stopping because right before you said it, someone in the freaking...
Okay, I'm just gonna read the last part.
Oh, it's still filming. Where is the device implant? Precisely. Like Kajina said, it is important to take the... whatever.
But no longer can.
The pouch can be worn on the back, upper arm, lower abdomen,
Or buttocks.
the patch can be worn on the back.
What are y'all doing? You're all supposed to raise your hands.
Oh.
Do this thing, Brittany.